What's up, my friend?
Evan Osar, Dr. Evan Osar. Is it really you?
Is it really you? You look no different except for your hair's a little more silver.
I know, man. Every time I look at you too, I'm like, why hasn't he aged? 20 years now I've known you, and you look exactly the same as the first day I met you. How are
uh,
you?
Very good. How about yourself?
I'm doing good. So I want to jump right into it today
Sure.
because, I've been following you for a long time secretly. And what I love about you is your demeanor. You have a lot of kindness when you share your work, a lot of humbleness. I think you and I can agree that you can kind of tell when somebody's walking the talk, and it's interesting because it's like you do corrective movement, which I want to talk about in a minute, but there seems like there's other stuff in there that I'm kind of curious about, like what it is that kind of makes Dr. Evan Osar this beacon of light beyond just the corrective movement world. To me, you just seem like a really great example for a lot of us that are trying to figure out our niche and figure out what role we play with regard to wellness. And it's like, I think that you just do a tremendous job. And I just think that you just have so much to offer. So I just want to jump right in and just ask you, how did you end up where you are? And like, so what do you do and how did you end up there?
Dan, I appreciate all the kind words, and I've had the pleasure of meeting a lot of incredible individuals over the years. Like yourself, and Jill Leary, who's another Soma student, and my wife, who was actually a student of at massage school as well. And I feel blessed that I'm a Christian, so I'll say God. God puts the right people in our lives, and I feel very fortunate that the right people came into my life at the right time. So I think that's true for everyone. And sometimes the people come at different times. I think people come to us to, number one, either teach us a lesson, number two, to challenge us, and or to support and love us. And obviously, I've had my share of all those individuals. And in that journey, because again, one of the things you're alluding to there, Dan, is like we've all had our journey, and our own personal story that gets us to where we are today and heads us in the right direction. And I think it's, for me, I've struggled a lot in my life, so I don't want to sit here and pretend that I have it all figured out, or had it all figured out. I've been challenged several times, multiple times throughout my life. And I think it's those challenges that help us to rise up and become that person that we're supposed to be, that, the leader for our families, for our communities, for our industry, for the world, on a larger scale. And, I feel, like I said, I feel very blessed that the right people have come along. And it's interesting that you use the word light, because I was struggling, like, during COVID. Obviously, I'm a pretty transparent individual from that standpoint. Like I was struggling early on in COVID, and actually for the last couple of years, and looking at what's going on in the world, and how people are treating each other. And Janice said something to me. She's like, Evan, just be the light. Interesting that you used that word. And then I was talking to her uncle, so Janice's uncle, who's a pastor, and similar conversation. He's like, you just have to be a light.
Wow.
As a Christian, you just have to be the light. And I'm like, that's kind of interesting. That's exactly what concept, or that meaning, keeps over again. And I think here today, when things can be dark or seem dark, or we all get into those dark places in our life and during our journey, we just have to keep finding ways to be the light. And I think that comes in many different ways, from a spirituality or religious sort of standpoint. It's self-care, like making sure that you're taking care of yourself and nurturing yourself so that you can be a provider and a leader for other people. It's sharing your passion, sharing your purpose, like what you were put here to do, and as another thing I struggled with a lot of my life. And I know I've been put here for a reason. I don't know if this will be my end reason. However, it's my reason right now. So again, I would encourage individuals to think about your own life and evaluate your own life, the people that are in it, and just to make sure that you're doing the things on a regular basis. I journal every day. I do my breathing every day. Some days, obviously I'm more focused and and attentive to it than other days. However, I still do it just to keep that habit. And you just have to keep those habits of taking care of yourself, your mind, your body, those things that we can control. And I think you and I would agree that there's things that we can control. That's the thoughts we focus on, the actions we take, and how we show up and serve in the world.
Wow. Gee. Did you have that like prepared? Because that sounded like really concise.
Sometimes it just comes out right, and again, that has a lot to do with you are a great student and a great individual. You have a great energy about you, so it's very easy and natural to have a dialogue like that. Whereas other people, yeah, I'd probably struggle to get that out and say that in a concise way. You create that, you understand, you create that safe environment for people. And that's what we do as practitioners. Our goal is, or I should say, one of our responsibilities is to create that safe space for people so they can be, have that enlightenment, so to speak, whatever that means to them in that part of their journey.
Wow. So you mentioned self-care, Evan. If a patient was thinking, I'm thinking about going to see Dr. Osar, what is it that you would want them to know about the work that you do?
Sure. I think self-care is huge, as as a body practitioner, someone that's involved with, someone's spirit, energy, their physical body. Self-care is important. I think the other thing that is lost in our healthcare system today is you need to be a representative of what you believe. And for many, many years as a chiropractor, I was not doing good self-care. I mean, I was working like crazy hours. I wasn't sleeping very much or well. And I was working out just enough to work out and say I worked out. It wasn't a good workout. I was just beating my body up and just getting a workout here and there when I could. And, one of the things that came out of COVID for me was, was sort of that forced slow down, that forced like stop and just like take stock of what's going on in the world, and more importantly in my own personal world. And I used the stress and anxiety that I was going through during the time just to, I'm like, what, can't control a lot of what's going on in the world. I'm just going to focus on getting better sleep, getting myself back into the kind of workout shape that I wanted to be in, and eating better. Like when everybody was like gorging on alcohol and junk food and whatever drugs and stuff like that, I'm like, I'm going to focus my energy on getting myself as healthy as I can. And even coming out of a COVID, so to speak, not that we're out of it, but just where we are now, I just want to keep focusing on that because I do believe that if you're going to be a leader, you need to lead by example. And so you have to preach, I should say, walk what you preach. You can't just preach it. You have to be a representation of what you're putting out there into the world. So I struggle with doctors, especially, or other people in our industry who it's like, yeah, eat well, exercise, and be all spiritual and energetic, and they don't take care of themselves, and they put garbage in their bodies, and then they're trying to tell us to be spiritual and connected. Being connected and being spiritual is nurturing your spiritual self as well as your physical self. So it's hard to be spiritual and when you're dealing with chronic pain or you're overweight and things like that. And so I do believe that self-care, what you put in your body, the things you do on a regular basis from a physical standpoint, the exercise, the rest, the breathing, the meditation, if you're into that sort of thing. I mean, even walking out and just being quiet, taking the headphones off and being quiet. I mean, that's part of self-care, just being out and being alone and just observing like the sounds, the sights, things like that. And and again, please, don't get me wrong. I don't have it figured out, and I'm not perfect at this. I'm a definite work in progress. So, I'm a big proponent of self-care, and it's always there's not a destination of self-care, just like there isn't a destination of health. It's a continual process, and it's addressing the health issues that arise at different points of our life. And it's most importantly, I think what I'd like people to really take stock of is take control of the things that you can control. The things you put in your mouth, into your body, the things that you do with your body from a physical standpoint, the things that you can do and maybe add in. And we'll talk about a couple of those, simple ABCs that you can do every single day that doesn't take a lot of time out of your day and can make huge differences in posture, movement, and how you feel, and start that process if that's not part of your regular process.
That's amazing. And I'm going to be asking you about that in just a few seconds, right? In terms of like taking us through a little something, a little gem from Dr. Osar's, infamous toolbox, because you are getting a lot of recognition worldwide. Even in our workshop, we had several people from all over the world, from Ireland to Dubai to, I don't even, United Kingdom. And so congratulations there. I think that's totally appropriate,
Thank you.
What do you think is the biggest hang up that people have with regard to self-care? So like if you just took a snapshot of your general patient population, what is it that you feel is kind of, it like serves as like the biggest block or challenge for them when it comes to taking care of themselves? What do you think it's all about?
I think it's twofold. Number one is, and I think this is a societal problem, and we're all, and again, please don't get me wrong, I'm not saying I don't give away my responsibility or take responsibility. I think people don't take responsibility. That's the first thing, is we don't take responsibility for the things that we can control. Again, self-care being one of those things. So that's the first thing, is we have to be responsible for our own bodies. Number two is understanding that we can directly and dramatically improve our body by and doing self-care. And I think for many of our clients, they really don't understand that, and that's part of our work when we work with our clients or patients, that, to give them the education, the understanding, the awareness that, yes, you can do a lot. Maybe again, God forbid, you have a diagnosis of maybe COVID or cancer or, diabetes or something like that, heart disease. And, maybe it's genetic. Well, you can't change your genetics. And I love this quote by, I believe it was Caldwell Esselstyn. He's a medical doctor. He was a medical doctor out of Cleveland Clinic. And he said, genetics loads the gun, your lifestyle pulls the trigger. And I love that quote because it really illustrates that we can't change our genetics. We're all predetermined with our genetics. However, our epigenetics, how we allow those genes to express themselves, are very much lifestyle related. So if we can help instill that into our clients, then it gives them hope or faith or a plan to say, hey, you know what? My mother had heart disease, or my dad died of cancer or something like that. Yes, in my genes. However, these are the things I can do to mitigate my risk of developing that same sort of condition. And even if I do get this condition, at least I'm going to create an environment that's going to help me go through that process and nurture my body and my spirit and my essence, so to speak, my cells, as best that I can.
Have you seen a lot of like miracles and or amazing impact on people's genetic health based on the work that you do with corrective movement?
To be honest with you, I can't say that I've seen dramatic genetic changes. Like, all of a sudden this person was like sick and dying and now they're not. So I generally don't attract that type of population. I will say, however, that there's lots and lots of testimonials of people saying, hey, you know what, Dr. Osar, I've been to my medical doctor, or I went to physical therapy, and you were the first person that, you spoke a language that I could understand. I started to do your exercises just that I saw online, and they worked better than the ones that my physical therapist or my chiropractor or my personal trainer was doing. So, that obviously is super, cool and and humbling to hear people reach out and say things like that, and to give people the hope that yeah, there's things that you can do if you understand some just simple, concepts of biomechanics, motor control, things like that. And I'm one of those people, and I think you are too, that regardless of how someone comes to us, to you, to me, I don't put restrictions on the clientele, that person's, nervous system, their spiritual being. I'm like, I'm going to do the best I can for you. And if you got cancer, we're going to do the best we can, and support you along your cancer, your heart disease, whatever else you have going on, so that you can express your genes in the best way possible. The one thing I don't do a lot with nutrition, because I have a nutritionist that I refer to. And I believe that you can't be a jack of all trades. I'm really an expert at what I do with posture and movement. I can't be an expert also in nutrition. You have to do one or the other. You can dabble it. I dabble in nutrition, and I can have a conversation about it, but I'm not the expert in that, and I don't want to pretend that I am. So I'll defer out to the experts on that. So, it's again, as we talked about, it's the mind, it's the body, it's the spirit, it's the physiology, it's everything, and that's what will help an individual express their epigenetics on a different level.
When we talk about your ABCs,
Yeah.
Wellness should be simple.
It really should.
And you make it that way. You break it down into bite-sized pieces, and you start with the most critical ones. It's just really, really powerful. And I'm just wondering if maybe you wouldn't mind taking us through a little something, a little guided Dr. Osar, self-care process. Would you be so kind to do that for us?
I'd be happy to. I'd be honored to. And you see, Phoebe's joined us too, because she likes some of this as well. So one of the things that you touch upon is the simplicity of some of the things that people take for granted, breathing being one of them. I'm sure you hear it from your clients. I hear it from my clients, of course. People are like, Dr. Osar, I breathe all day long. Why do I have to do this breathing thing? And my one comment to them is, you've walked your whole life. Does walking get better over the course of your life? Not unless you work on it, right? If you look at, like our 70, 80, 90-year-old individuals, their walking doesn't get better. It gets dramatically worse, slower, more hunched down, less steady, less balanced. So breathing is similar sort of deterioration when we don't work on it, when we don't pay attention to it. And even now, I just found a brand new study that just came out, and it looked at breathing in elite athletes. And even the article was stating that athletes training at a high level, elite athletes, professional athletes, they don't have awesome breathing unless they specifically work on it, even at training at elite level. So we can all benefit from more optimal breathing, just like, it's like our nutrition, right? We could all benefit from cleaning up our nutrition, doing simple things with our nutritional program. So here's one thing, a really easy thing that we can do. The one thing that we do to help individuals understand the importance or recognize the importance of breathing, or the impact of breathing, is just to do a quick, what we call self-checks. And self-check is just a way for you to check into your body so that you feel where your body is now, and show or demonstrate like how a simple thing like breathing can dramatically change your body. So let's just take neck rotation, for example. Just rotate your head as if you're looking over the right side of your shoulder. Come back to center, go left side. Okay. Then do that one more time and see if you notice one side that's a bit more restricted. For me, it's my left side. Okay. Now do the same thing with your side bend with your head. So go left side or right side, come back to center, go left side. And again, same thing, like going to my left, a little bit more challenging, compensate a bit more going to my left. Now, we would generally take a strap. So I would use a strap that will use this one right here. So just you can use a resistance band or a yoga strap and just wrap it around the upper chest like that. And the reason why you use a strap is to give you some kinesthetic feedback, or so that you can feel the idea that your ribs are expanding, because your ribs should open up and expand into that strap or that band. The goal is not to squeeze and pull tight. It's just to give you that sort of feedback so your brain can find the region where you are restricted. Now, the other thing that's important about breathing is most of our clients, most of our society, because of trauma and stress and anxiety, we breathe too fast, we breathe too shallow, and we tend to be mostly mouth breathers, okay? So we wanna make sure that we keep our lips closed, our mouth closed, breathe through the nose. So that warms, that moistens, that filters the air, and it also helps us slow down the breathing rate. Okay, so now what I want you to do is just very gently sit at the edge of your chair so that your feet are on the floor, you're perched up on your sit bones, and you're gently feeling as if you're being pulled up from the backside of your head and neck. Just gentle, not forcing it. Now you feel the strap around your rib cage. You're going to breathe in and feel as if you're expanding into that strap, and then breathe out. And generally you want to breathe out a bit longer than you breathe in. So if you breathe in for 1,000, 1,000, you pause and then breathe out for 1,000, 1,000, 1,000, 1,000, and pause. Breathe in, 1,000, 1,000. Breathe out for 1,000, 1,000, 1,000, 1,000. Pause. Do 3 more breaths like that. And relax. And now let's just see if we made a difference. So that was about 5 to 7 breaths, a couple minutes of breathing. Now let's recheck cervical rotation or your neck rotation. Look over your right shoulder, and that is actually way easier for me. Left shoulder, that is not as good as my right side, but still way easier. It doesn't feel like it's catching or stopping me as easily as it did before. Side bend your head to the right, come back to center, go left, and that feels smoother and easier for me as well. So just in that 5 to 7 breaths, more focused, more awareness, more attentive to our breathing, we could change cervical range of motion without doing any myofascial release, without doing any massage and or stretching. And now think about that. If we can add our exercises to that simple activity, like how much different our body could feel. Just in our neck, we felt a difference. But we were also changing our physiology. When we breathe slower, you know this, when we breathe slower, more purposefully, and more attentively, we decrease that sort of sympathetic overdrive where that makes us anxious, makes us, stressed out, and makes us even depressed. And it starts to ramp up parasympathetic, which helps us rest, helps us relax, helps us breathe at a slower rate as well. So optimal breathing enhances the parasympathetic state, and the parasympathetic state helps enhance and reinforce optimal breathing. So they go hand in hand. Once you change your neurology and your physiology, now you can start to change more of the physical aspects of your body. And that's how we can start to use these simple concepts, the alignment. We started with the alignment, breathing, and then we teach you how to control that with specific exercises and movements. And ultimately do the things that people want to, because ultimately people don't come to us because they necessarily want to exercise. They want to do things in their everyday life. These are the simple things that we can do to help us do those other things that we want to do in everyday life, like play with our children, grandchildren, to go hiking or biking, to just get up and feel great every single morning versus waking up and it takes us an hour or 2 to get going because our body is just so beat up. So hopefully that helps and brings some light to how powerful, simple, powerful concepts like 3-dimensional breathing can be.
Dr. Osar, how often do you practice this personally, and do you ever find yourself kind of like forgetting, like, oh, I should be breathing right now, like is like because you're like the expert, right? Like this is your bread and butter. So like, Now you being put on the spot, like, okay, so
Yeah,
how does
yeah,
this look in your life?
yeah, yeah. I do my breathing every morning. Now, depending on where I am in my head and what I have to do that day, it's anywhere from 3 minutes to 15 minutes. And should I do it more frequently? Absolutely. Meaning, like, I just had improved cervical range of motion. I've been doing a lot of online consultations right before you called. So, I've got myself a little slumped down, a little hunched over. So I had lost some cervical rotation. So just doing that breathing exercise, for me, teaching it is just really a way for me to reinforce it. I do a lot of posts on Instagram, like some inspiration, motivation sort of posts. Most of the time, I'm posting for myself. It's really just a reminder for myself, and in posting for myself, hopefully, it helps some other people along the way as well.
I love that about you, man. Like that's kind of like what I'm getting at as far as I just appreciate you as a person, as a brother in Christ, if I will, if I could.
Yeah.
Um, but I love the fact that you walk the talk. I mean, honestly, you really haven't aged in 20 years. It's kind of weird, like, has
I said
anybody asked you if you are a vampire yet?
but dude, I said the same thing about you, man. You look exactly the same. Like I've seen you on Facebook and here and there, and now as I look at you, like this is the first time we've actually talked face to face or camera to camera. I'm like, holy cow, dude, you look exactly the same, except you got a little silver in your hair. I'm like, so you're drinking the Kool-Aid too. Whatever I'm drinking, you're drinking too. So lots of good water and spirituality, I guess.
Dr. Osar, how do people find you? Who are you looking for? Who are you looking to serve?
So we teach to health and fitness professionals just like you. So, we just had a what we call an IMS Masteries last weekend. And this is where people have been through our year-long intensive. They've studied with us ongoing, and they come back once a year. Last year, obviously, we couldn't do it live, but this year, people came back in live. And we look for people that very much like you and I, humble people that are going out there every single day to change other people's lives, to serve. Because I think when we think about our purpose in this world, it is to serve. And I'm looking for people just like you and I, like people that are looking to serve and make other people's lives better, to make themselves better so that we can better serve and lead our communities. So from a professional standpoint, our education, that's who we're looking for. From a patient perspective, I'm just looking for people that are open-minded, that understand that, or come to the recognition, even if they don't understand it when they first come in, is that we are responsible for this vessel that we've been given, and what an amazing vessel it is, and that they want to learn everything they possibly can about taking care of this vessel so that it allows them to do the things that they were put here on this earth to do. So people that are, number one, open-minded, people that are, looking for, again, that sort of idea of like simple is what makes the biggest differences. Unfortunately, people come to us and they're looking for this magical thing. People are like, oh, this is so subtle, I don't feel anything happening. And sometimes that's possible for sure. And we want to recognize that and embrace that. However, it's I think too many people are looking for that magic, that big magic cure, so to speak, and they pass on all those little subtle, as we said in the course, that you went through, Dan. Like subtle is not insignificant, and subtle things like breathing, subtle things like the thoughts that you focus on, subtle things like getting a little bit of extra sleep or putting your phone down a little bit sooner before you go to bed, or not looking at it first thing in the morning. Subtle things like just doing a little bit breathing, just taking a moment out of your day just to take 5 breaths to sort of check in and balance out your nervous system a little bit better. Simple thing like just saying hi or smiling to somebody just for no reason at all. And again, like I said, Dan, every single day, and that's a value of journaling, not to get off the topic, but of journaling, because it allows self-reflection every single day, whereas many of us just go to bed thinking about whatever, watching nonsense TV or things like that. The reason I like journaling, I never did it before the last couple of years, but the reason I really like it now is because it gives me that moment, just those couple minutes before I go to bed, to like, what happened today? Was I serving God like I was like I've been put here to do, or was I a little rude or obnoxious or short tempered, or did I do things that weren't in alignment with my purpose? So it gives me that opportunity, and then also to celebrate some of those things that we take for granted. And I'm one of those. That's one of my biggest faults is I take for granted those great things that happen every single day and just pass them off like, yeah, whatever. This is just normal everyday stuff. Whereas like, no, that's pretty darn amazing. We're looking for that huge, like, hey, I just won the lottery kind of thing that we lose the beauty in all the subtle things. So people that are open-minded and ready to, have someone like us, like you and I, work with them on their journey and on their process.
Yeah, well, I couldn't agree more. And, Tom Myers told me one time, I think he was telling me that behavior modification is medicine for the 21st century, right?
Yeah, yeah.
And the other interesting thing with my own personal journey and training is that in Hawaii, my main Hawaiian teacher, he just constantly hammers on the point of habits. Like, he said that if you don't talk to people about habits, you're basically just taking their money.
Yeah, pretty much.
And what I love about you and the work that you do is, yes, you talk about functional movement on a macro, but you take it down to the micro. And I think that that's like the part that some people are like, oh, what's this? I don't even feel that, because they're looking like for the holy 2x4 across the face. Like, whoa, okay, I felt that.
Right.
You know what I'm saying?
Right.
But I just love the fact that you break it down to the micro, because we're constantly dealing with the accumulated reality, right?
Yes. Yeah.
Like, people's behaviors accumulate. Like, you could probably eat whatever you want for a certain amount of time. You
Yes.
could breathe however you want for a certain amount of time. But at some point, there may be something that shows you that wasn't the best strategy, right? And that's what you just constantly keep hammering home, is this idea of like optimizing strategies,
Yeah.
And I just appreciate you so much. And so, how can people find you? How can people reach Dr. Evan Osar? What are your handles? How do we reach you?
So you can find me. I spend the most amount of time on Instagram. So Instagram is our company. We've changed our company names, but you can find us right now at IIHFE. IIHFE. So you can find me there. You can find me on Facebook at Evan Osar, just my name, last name Osar. And you'll also find us on Facebook. Again, we're changing the company name, so it's going to take a little bit of time to transition it. But right now, you can find us on Fitness Education Seminars. So Fitness Education Seminars on Facebook as well. Usually I'll post to both places, or the posts that I do on a regular basis will get sent to both places. I'm a little slower on Facebook. So if you do reach out that way, just keep reaching out, because I think similar to you, Dan, you reached out for a while. You were just persistent, and finally I get back to you. So I do appreciate your persistence. So if you don't hear back from me, just reach out again. Just let me know that you reached out.
Absolutely. Well, and again, I just want to thank you so much for being you, for being the light that you've chosen to be. And honestly, like, if I just assess the fruit, okay, like just what you got going on, like that's really the best way. It's just like the assessments that you do, right? It's like, how do you know that what you're doing works? Well, you did an assessment, right? So, when I look at you and I look at your work, I don't see you like harping on anybody about your faith or about spirituality, but you don't need to. Like, people want to ask you questions because you walk the talk. Why is Evan so like cool, for lack of better words, but just really sweet and kind and humble and joyous and peaceful, and even when you took me through the breathing a few moments ago, it was like, it felt even better than when I do it alone, because I felt this support, from you, like, and I think that that's just a really important quality when it comes to facilitating healing. I'm just really thankful to know you, and I'm thankful that you're walking the planet with us, brother. And I look forward to having more conversations with you in the future if we can.
I would love it, and I appreciate you as well, and I appreciate everything that you're doing, because again, one of the things that you just said it. I remember going to my niece's christening, and it was a Catholic service, and the priest had come from a different denomination. I forget which one. And what his message really struck with me. He was like, don't go out there screaming that you're a Christian or whatever you are, right? Whatever you follow. Let your actions speak so loudly that nobody, people want to come up and ask you about it, and that really stuck with me, and I really appreciated that. So I appreciate you saying that as well. And I think that all of us as practitioners, like, let what you do speak so loudly that people just want to come up and ask you questions and learn more, and just be authentic in what you do and how you present yourself and how you serve people. So I appreciate what you do, and I look forward to having further conversations for sure, and getting together again.